Okay. So when you're trying to go indirect, you benefit, especially in seated, from the side that you want to go indirect on to be more exposed. So if I wanted to work on this side, I would be over here. If I wanted to work on this side, I'd just be over here. The reason is simply wherever I am on the vertebral column, my hand is better this way than if I was working, say, on this side and I was on this side, I have to do this, right? So it's just harder for me to get my hand on. When my hand can be like this in seated, I get a lot of information even up to the thumb. So I just benefit from this. Blah, 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 blah. I'll put this hand on that shoulder, right? So just as a simple concept, right? So if I want side bending either direction, all I do is this. If I want rotation either direction, it says, is this the best for any of those movements? No, because the position that I'm in, I have to limit it because I just can't move as far. That's what it is. But say I'm here in the low lumbar column and actually here, you agree? Mm-hmm. So my hand is actually this way now, and the top of my hand feels the most resistance. And it's literally that sometimes. You just put your hand on, and as you push in, something just won't move the same, right? Now, obviously, there's ribs there. It's just like, okay, is it just the ribs? No, it's not just the ribs, right? So now I soften it. And little movements, nothing fast, right? So nothing like this. This becomes the problem. Now, if I had her do this actively, right? So, okay, what I'm gonna have you do. So, say I'm here. Okay, what I want you to do: bend to the right just a little bit. Stop. Come back a little bit. No. Come back off the side bending. There. Now twist a little bit to your right. That's good. Bend a little bit to your right. That's good. Okay, so now that I've had her actively get into a place where some tension comes off, and then I come in and add the activating force, that's functional technique, right? So it all ends up having the same thing when you're going indirect. You're just trying to get it all to soften as much as you can. Now, because she actively started, I have to search for it more, and once I get there, I wait, and then I can move a little more. Okay, so visually, we'll have you on your stomach if you're comfortable. I really hope you're comfortable. So when you're in prone, one of the things that ends up happening, if you're trying to soften anything, so you can do short lever work on the tissue, totally fine, right? Pushy, pulley, slidey, twisty, and whatever of those ends up in total softening it up as much as you can, totally fine. If you're trying to soften a region, one of the things that you run into, you can use the ribs, right? So if you look at how much motion I get, you can use the ribs, right? Sometimes you can use this, but you see I slip over tissue because you have to bottom tissue out before the bones will move with it. If I use the shoulder, so let's just say we use the opposite shoulder, bring this up beside you, right? You'll see that's slack coming out of the scapulothoracic region. Whereas if I do this, right, the scapula doesn't move as much, so I kind of got to jam it and then move it more or less as a unit. But now the strong sensation is my forearm, so I run into some trouble there. Lift the arm back to the side so it's a little bit more comfy. Now, if you just use the region of the sacrum as a handle, so I'm not necessarily on the sacrum, but look at how much movement I can get out of her without much pressure. Now, really, to get as much movement as possible, I have to keep her going back and forth. Whereas if I want to push her that way, if I use the sacrum, it'll move okay. But if I come to my side into the kind of posterior iliac spine, right? So you just kind of sink into some tissue relatively close to the midline, I can get a decent push. And if I come to the other side, now if I just do this, it's not going to work. If I come to the other side and I get around that iliac crest, whoops, sorry, too fast, right? Sometimes it works good, sometimes it doesn't. The comparison is to this. I can get more movement out of this, but now I feel my forearm. And I'm going to start to have my hamstrings, because I've got straight legs, my thighs are on the table, my hamstrings are going to start to get it. Whereas this, not as bad, right? So if your hand is big enough to go to either side, let's just say it's here, because it is here, and the search is what matters more than anything else. Now, this softens it up better when I come this way. So it's counterintuitive. I figure I would have to push it the other way, but now when I actually do it. So when you're going indirect, if you remember the diagnosis, you'll trick yourself. So you need to remember the diagnosis so that you can retest it. But if you think about it when you're going indirect, you'll think about the movements that it wasn't doing well, and then or the movements that it was doing well, and you'll go that way. You're trying to make the soft tissue soft. So it's whatever combinations of movements that you need to do. And sometimes it's the little, like this doesn't do it as well. You agree? And I didn't move my hands, but that makes it better. Just my angle. So just the angle that I'm on, without moving my hands or taking any pressure off, it changes what she feels, what's happening to that tissue. So you will have lots of times when you have to do little tiny footwork changes. And it's the search that matters more than the move, as unfortunately is always the case.